Teeth mobility is a sign of periodontal disease. But the scariest part of this is that this can be happening to a person without them even feeling much or without them even knowing. How does this happen? Why does it happen? And how to prevent it is what I'm going to talk about in this video. My name is Dr. Mo, and I'm a dentist. I'm going to segregate the process into three stages. Stage one of this can start at something as simple as gingivitis, which is a form of gum disease. So gingivitis is simply the inflammation of the gums, okay? Where if gingivitis, which is the stage one of what we're talking about, is left untreated, we move on to stage two, which I'm going to dive into deeply shortly. Stage one gingivitis can be seen as reddish or puffy gums or somewhat even painful gum at times. Irritated gums where someone may feel discomfort, some pain again. All of these are some symptoms can someone feel. If the gingivitis and the gum disease is left untreated and people may ignore it, we move into potentially into stage two, and that is periodontal disease. Periodontal disease slightly more, or it can be not only slightly, it can be really more serious in comparison with gum disease because we're no longer only dealing with problems in relation to the gums, but right now we're potentially expanding to the underlying bone. If you didn't know, the tooth itself, the way it's firm and held in its place is because of its supporting bone around the root of the tooth in particular. And I'm not going to get into too much dental terms and jargon. I'm going to tell you what you need to know in relation to this. Okay. So let's say we get to stage two, periodontal disease. There are many different types of periodontal disease. There are different stages of periodontal disease. You can check out the American Academy of Periodontology. They describe periodontal disease in terms of stages, and there's also some grades in relation to this. I think stage up to four. So you can research this later. But what I want to tell you is in relation to periodontal disease, what really happens if it progresses. So if periodontal disease is progressing, and as I said, the bone starts to get affected. We're losing bone that's supporting the tooth. We can start to see signs of tooth mobility. The tooth becomes more mobile. The tooth becomes more loose. Okay. And that is very problematic because if this keeps progressing and it's left untreated, unchecked, the person did not care about it, at some point they may even completely lose that tooth or lose these teeth. Okay. So they could lose more than one tooth due to periodontal disease. In fact, in periodontitis, if it's left untreated and if it progresses aggressively, a person may lose even all of their teeth. Okay, which gets us into stage three in this context, the context of this video. Stage three, we're talking about periodontal disease being left untreated, and now there's potential for not only tooth mobility and tooth loss, but also a lot of people don't even know that periodontal disease it can be associated with some other medical diseases that someone may have. I'll give you a very simple example. You can read about periodontal disease and diabetes. That's all for today. Don't forget to like, share this with your friends.